Hi everyone, my name is Ceyhun Ergin. I am a lecturer in economics at Columbia University. I live in New York City with my wife, who is a postdoctoral research associate at NYU Langone, my daughter, 4-year-old daughter, and my mother, 66-year-old mother. The reason that why I'm making this video is that I want to share our experience of COVID-19, because three of us, me, my wife, and my mother, got COVID-19 in the last few weeks. I want to share my experience with you and how we went through the US healthcare, the ridiculous US healthcare system, and hoping that our experience will shed light on potential revisions and, reforms of the US healthcare system. And because it was really a really ridiculous and moronic, so to speak, experience. So let me explain what happened to us. So we are living in Manhattan, in New York City. However, on March 19th, in order to be close to a rural area and at least, to get some sort of fresh air for my daughter, especially, and since we were working remotely, we rented an Airbnb place in Ulster County in upstate New York, which is about 90-minute driving distance from New York City, in close to New Paltz area in Gardiner, New York. We rented an Airbnb place there and we went there. But then on March 30th, first my wife, and then on March 31st, my mother started to experience the symptoms of COVID-19 with coughing. First, it started with little fever, fatigue, and muscle pain, sore throat, and so on and so forth. And then on March 31st, we immediately called New York State hotline, the phone number given by the New York State Department of Health, to ask for testing, especially for my mother, but also my wife and me, and potentially for my daughter as well. When we called them, we gave them a lot of information. I think they have an algorithm in mind. They asked a lot of questions like, the symptoms that you are feeling, your age, and so on and so forth, to prioritize people who get tested first, who should be getting tested first. And we gave our names. We also emphasized that my mother is above 65, and so on and so forth. And then they said, okay, we will get back to you. So we did that on March 31st, and they got back to us, by the way, 11 days later, on April 10th, at which point my mother was already hospitalized, which was ridiculously late, as you can imagine. But anyway, so we gave our information to them. But then my mother's symptoms, also my wife's symptoms, started to get worse. And I noticed that the Department of Health of the Ulster County also has 2 testing locations. Now, one issue is that also, that I want to give information about is that even though me and my wife, we have health insurance through my wife's employer, and as well as my daughter, my mother is a visitor from Turkey. She was here, she came to US in February. She was a touristic visitor, and she was supposed to stay here for 4 months. She bought a travel health insurance before she came to here. However, we learned that eventually that throughout the pandemics, these travel health insurances don't pay a penny because they are relieved of their responsibilities throughout pandemics, apparently. Even though we did not see that under terms and conditions when we bought the insurance, for some reason, so they're not going to pay any penny for the healthcare services that my mother received in the hospital. I will come to that later on. Then, so when we noticed that the Ulster County also has 2 drive-through testing locations, I called their hotline, the Ulster County COVID-19 hotline. And they told us, yeah, okay, we can make you an appointment, but we need a doctor's note telling us that you require testing. Okay, we said, then through my wife's employer, through my wife's health insurance, we made an appointment, a telehealth appointment with a doctor. And the doctor, throughout a telehealth video conference, examined my wife and came to conclusion that her symptoms are really COVID-19 symptoms and she should be tested. Then we said, okay, but we need a note from you. They said, okay, I will send you a note via email. And the doctor basically sent a referral note to us asking for testing of my wife. We called the Ulster County hotline again with that note, saying that, okay, now we have the note. Okay, they said, which is good, so we can give you an appointment. However, they said, you need to print out the note and bring the printed out note to the testing location. The Airbnb house that we rented did not have a printer. So we said, okay, we don't have a printer, but we can bring the notes, in a smartphone, and we can show the note to the testers if needed. They said, no, you need a printed out note. You have to print it out. But then we said, okay, we need to go to a Staples or, print store, but we are not supposed to interact with people because we are, potentially COVID-19 positive. So we are not supposed to interact with other people outside. They said, okay, but this is the rule. You need to print it out, which is another ridiculous policy, unfortunately, which also shows that how unprepared, by the way, the state or the county health departments were to this pandemic, actually. And then, thankfully, our landlord had a printer. We called the landlord. Landlord printed the note, brought it to us, and we took the note, went to the testing location with my wife, me and my wife. But when we went there, they refused testing my wife because apparently the doctor's note was a referral, but apparently it had to be a script. So whatever the technical difference is, so they said a referral doesn't count. You need to get a script from the doctor indicating that she should be tested. Then we tried to call the telehealth system, but whenever we called the telehealth system, the average waiting time was always about 100 minutes. So we gave up, by the way, our efforts to get tested, to get my wife tested, unfortunately. And thankfully, my wife started to get feeling better and better over the next few days. However, it wasn't the case for my mother. My mother started to get worse in the next few days. Then I called the Ulster County COVID-19 hotline again and explained to them that she doesn't have insurance, but she is potentially COVID-19, what we should do. They suggested to contact us, the Institute for Family Health in New Paltz, and they should be arranging a telehealth appointment for my mother, and then potentially they can get her tested, and then we'll see what's going to go on afterwards. And actually, the Institute for Family Health in New Paltz was one of the, single good things in our experience throughout this nightmare, because they were really very helpful. They made an appointment for my mother very quickly on the same day, telehealth appointment. Throughout the telehealth appointment, it turned out that my mother really needs testing. I took my mother to testing location in the New Paltz, the Institute of Family Health testing location, and they tested her. But throughout the test, they also realized that her oxygen saturation level was really low, around 88%, and then they recommended that she should be hospitalized. And they called for an ambulance. The ambulance took my mother to the Vassar Brothers Hospital in Poughkeepsie, New York. And my mother stayed in hospital for 5 days. We waited for the test results for 2 days. So she stayed there for 5 days in the hospital. And in the first 2 days, they waited for the COVID-19 test that they made in the Institute of Family Health. And when the results came out as positive, they started this hydrochloroquine and azithromycin treatment to her. And then they discharged her 3 days later. So she stayed in hospital for a total of 5 days. In the hospital, whenever she was admitted to the hospital, they also made her 2 tests, very quick tests, COVID-19 tests, for which the false negative rates apparently is much higher than the slower tests. And for these 2 fast tests, the results were negative. Both of the results were negative. However, 2 days later, as I said, the more reliable test turned out to be positive, and they started the treatment for her. So they discharged her 5 days later from the hospital, and it was, in a sense, the treatment that she received in hospital was good as far as we can tell, and she recovered. And throughout the discharge, of course, since she doesn't have insurance, they also asked for some oxygen tanks being brought by a medical supply company to our house, which we arranged for and which we paid for. It was around $250 a month, a rental fee of the oxygen tank, which we did, and then 3 cylinders also. And then so they discharged her. But then the follow-up process after the discharge was again horrific, because they told us that some sort of healthcare company is going to follow her up, will call us and ask her conditions a few days after her discharge, but they never called. And the follow-up did not really go smooth. No one basically, was really interested in following her situation, mostly because she doesn't have insurance, I think. And also now she started to get better, but then I got COVID-19 positive. But I did not have much relationship with the US healthcare industry. I basically recovered at home with over-the-counter medicines. But then a few days later, after my mother was discharged, we got a phone call from the ambulance company asking where they should send the bill. We haven't received the bill yet, so I don't know how much it's going to be, but we will receive a bill apparently. And then again, a few days later, I got another phone call now from the hospital. They said, where should we send the bill? Then I asked, all the politicians and, the Governor Cuomo of New York and, President Trump are all mentioning that, this COVID-19 treatment is not going to be a financial burden for any of the patients. And, the government will sort of help intervene with that. They said, no, we are not aware of any of this. And the person that I talked to at the hospital was saying that she is looking at an about $24,000 hospital bill. And yeah, maybe I can apply on behalf of my mother to Medicaid or emergency Medicaid, which we are going to try to do in a few days. I don't know how it's going to go. So yeah, she's going to most likely end up paying all this huge hospital bill. And then actually 2 days later, we received yet another bill, which the hospital bill, I think, does not include. The emergency the services provided by the emergency physician in the ER at the hospital. I think it's a separate bill as far as I can tell, which is in the amount of $1,197. So we got a text message asking that we should pay the bill in that amount for the emergency services that my mother received in the hospital. Now, why am I complaining about all this? Is that because, are we gonna go bankrupt if we cannot pay this or not? No, but I'm just, I'm trying to explain this because now I understand, going through all these nightmares, financial as well as healthcare nightmare, that this is not how the healthcare industry should function. I am teaching public economics this semester, and one chapter is on healthcare and health insurance, in which I talk about all the inefficiencies and asymmetric information, adverse selection type of issues that arises from the very nature of the healthcare industry. But also, one thing that I want to show you is here, two pictures, if I can. So this is a interesting picture which shows the total health expenditures in different countries as percentage of GDP. And of course, US is an outlier here, spending as much as 17% of its GDP to healthcare, to health expenditures. These are the top countries, sort of the highest spending countries, top spending countries to healthcare. And US is an outlier even out of them. So US is the country which is spending the most, not only in absolute terms, but also as percentage of GDP to healthcare. But of course, whether this translates to good outcomes, whether this translates to a longer life expectancy, whether this translates to more people being insured, and no, of course not. The outcomes, if you rank the countries in terms of the outcomes or outcomes per spending, it is not there. The desired outcome, unfortunately, is not there. And also another interesting figure that I want to show you is, now, this is the total health expenditures, which include both the government spending as well as private spending. So it includes what all the private households are paying for healthcare, and plus what the government in the form of Medicaid, Medicare, or other type of insurance expenditures or healthcare expenditures is paying. And now this picture is now a second figure, which is now just the government health expenditures as percentage of GDP. In the case of US, as you can see, it is almost the half of the previous figure. So all these 17% of total spending as percentage of GDP in the US, half of them is paid by the government, which is actually comparable to Scandinavian or European social welfare economies like Norway, Belgium, or even Canada and Austria. So, which is just basically suggesting that US government is spending a lot, actually, both in absolute terms as well as percentage of GDP, almost as much as the European welfare economies on healthcare. But then on top of that, private households like me, like my mother, who's going to spend $24,000, or maybe even with the ambulance and the emergency with $30,000, for this treatment, COVID-19 treatment. But then if you look at the outcomes now, if you look at the number of deaths or the death rate, for example, and compare the death rate from COVID-19 in the US to the death rate from COVID-19 in Turkey, for example, which is where I am from, where in Turkey, by the way, it's around 4%. The total spending is 4% of GDP, 4%, as opposed to 70. And out of this 4%, 3.5 comes from the government and only 0.5 comes from the private households. The death rates are much lower in Turkey compared to US. Now, which is also suggesting that, you know, all this money is not worth the outcome that we observe. And I think it was also appearing in our nightmarish experience that we have gone throughout this COVID-19 pandemic. Thank you for listening, and I hope that all this experience will spark some discussions and then will lead to some improvements and reforms of the healthcare industry in the United States. Thank you.